to another episode of Health Exchange Chatroom. Welcome to all the Living at Your Finest champions. I'm excited that you're back again. Now, we are talking about arthritis, and that is a topic that is so dear to my heart. I suffer from arthritis in my early 30s. I come from a family history of just loved ones with arthritis. So, what better way to talk about it, right? So we're going to dispel the myths that are out there. We're going to differentiate false from fact. We are also going to talk about symptoms, signs, treatment, prevention. So there's a lot to talk about today. I cannot wait to dive in. But before I do so, I want to thank you for subscribing, for those of you that have subscribed. And if you haven't, what are you waiting for? Go ahead and subscribe. Do that right now. Press the button, press the bell. My son said call it ding dong. So go ahead and do that so that you don't miss any of the important videos that come about that speak about any health related topics. All right. Please, when you're in the process, leave a comment, share with a friend and family, okay? We all want to learn and grow together. Well, let's hop into the chat room and find out what the community knows about arthritis, and then we'll go from there. A guest in our Health Exchange chat room in person of Rita Shonea. She is a senior associate at Walls Financial Group. Welcome, Rita, and thank you for agreeing to enter into our chat room.
Thank you, Dr. Babalola. I'm glad to be here.
Awesome. Well, let's get right into it. Arthritis is the topic for today, and I am curious about what you know about arthritis. Can you share some light with us?
Arthritis, well, I've heard that it affects mostly older people.
Okay.
And also heard that it affects mostly women.
Mm-hmm.
Mostly African American women.
Okay.
I've also heard that it could be treated, but there's no cure.
Okay, I agree with that one.
Also, I've heard that it causes irreparable damages. You know, when you have it on your fingers, it makes your fingers crooked and your fingers are deformed.
Okay.
I've also heard that a lot of people confuse it with there's a difference between osteoarthritis and rheumatoid arthritis. That is a different one affects the joints and one affects the bones.
Okay.
I'm not a medical person, but that's what I've heard about it.
Well, you've heard quite a bit, so I'm glad.
Okay.
Well, that's why I'm here. We're going to go into a different session, and I would like for you to tune in and hear all the answers. But so far, you're not doing too bad. There are a few things we're going to dispel, but yes, but awesome. Thanks for sharing that information so far.
Good. And also, I'm sorry.
Go ahead.
Okay, I've also heard that cold weather makes the pain very, very excruciating. I don't know how true that is.
Yes, well, that is true. So when I say that is true, that means we don't have to dispel that. So that is absolutely true. Yes, yes. Okay. All right then. Well, thank you for sharing what you know so far about arthritis. Now, you said something so important, and I like that you said it, that you cannot treat it, but you can manage it, right? So you can't prevent it from going away, pretty much. You know, it's not just going to disappear. If you have arthritis, you can keep it under control. So I like that you said that. Now, can you share some information as to how you can keep it controlled? Do you have any idea of what you can do to keep it under control, since you brought that up?
Well, I heard that there's some medication that you can take. There are also some topical creams.
Okay.
That are over-the-counter topical creams that you could apply that could relieve the pain for some hours, and that's all I heard.
That's all you heard. Well, that's not far from the truth at all. But yes, but before we even talk about that, you know, I want to backtrack and ask, how do you prevent it? Because once you have it, you cannot prevent it from, you can't just make it disappear. So have you heard anything, you know, in your community, how to prevent arthritis? Because, you know, I'm a strong believer, and you are financial, okay, you know, you always talk about wealth all the time and how it's our health. Do you agree that prevention is better than cure? And if you do, what are some of those preventative measures that you can take to avoid arthritis from happening in the first place?
Well, I totally believe that prevention is better than cure for anything, any ailment, any disease, but I haven't heard about how to prevent arthritis. Like I said, I'm not a medical personnel, so I really haven't, I don't know how to prevent it.
Okay, well, very good. Well, that's what we're going to talk about in the chat room. This is, just an introduction to finding out what the general knowledge is on arthritis. Thank you so much for giving us your overview of arthritis. Was there anything else you wanted to add before we go into the full forum of discussion of arthritis?
Not really. That's mostly what I know about it. So
Okay,
I look forward to knowing more about it. Yeah,
awesome. Well, thank you again.
you're welcome.
Arthritis is a term that refers to joint inflammation or joint disease. Simply put, wear and tear of the joints. As of a study that was done by CDC from 2013 to 2015, it estimated in the United States that 26% of women had arthritis compared to 19.1 men who were reported to have arthritis. Now, again, the show is to help women live at their finest health. We got to do something about those numbers. We need to be empowered with knowledge to prevent this from happening. And in that same study, it was found that 65-year-old and older were more at risk at 49% compared to the younger age. So if it was 18 to 44, there were about 7.1. Between that age, it was about 23%. So this is definitely something that, yes, as our guest said, it is more in older people, but it still does occur in younger people. Now, what about race? What's the disposition with race? Now, let me tell you, he actually found out in that same study that even though the prevalence of arthritis is lower among Blacks and Hispanics, the effect of the joint pain and the physical and work limitation was greater in those race. Now, again, that speaks to how chronic diseases unfortunately disproportionately affects the minority class. So we do need to empower ourselves, be aware of what these risk factors are. Now, there's several types of arthritis, as my guest said in the chat room. The two that I'm going to focus on today is osteoarthritis and rheumatoid arthritis. Now, what is osteoarthritis? Now, osteoarthritis is the most common form of chronic long-term condition. Now, what happens? The cartilage that cushions the end of the bone at the joints, it breaks down. And once it does that, the bones begin to rub off on each other. And it causes all the symptoms that we'll be talking about briefly. Now, rheumatoid, what is that about? Rheumatoid, even though our guest said that rheumatoid affects the bone and osteo affects the joint, that is not correct. They actually both affect the joint. The only difference is the etiology, the mechanism. Now, for rheumatoid, it's more of inflammatory, meaning that there's an immune system breakdown. The immune system begins to attack the joints and the bones. It affects particularly the synovial joint. That's where all the lubrication takes place. It lines the joint. And when that happens, it causes a lot of disformity. So you might ask, what are those risk factors? I need to know so I can guard against this. Now, family history is a key one. I alluded to the fact that I do have a family history of arthritis. So in my family, unfortunately, lots of knee replacements, lots of joint problems, strong, hardworking women just really affected by these disease. Now, for me, when I was in my 30s, I started having all these joint issues, and I was like, oh, feeling like an old woman. And I really had to do something. I needed to be aware of what my risk factors were, which was one, genetics, but I also needed to pay attention to other things that were predisposing me to arthritis. Occupational hazard. So if you do a lot of repetition, wear and tear of those joints, without proper care of those joints, it can lead to wear and tear, of course. Diet, I know, diet affects everything, right? And when I say diet, I mean what we eat. If we eat a lot of inflammatory diets, meaning things that are processed, lots of sugary things, lots of fried food, it takes a toll on our joints, especially Coke. I know a lot of us are addicted to Coke. It saps out all the calcium. So there's a lot of addictive materials in these inflammatory foods that affect the bones and cause a lot of wear and tear. Trauma, weight gain. if your body's meant to carry only so much weight based on your height, there's added pressure on the joint. So as you can imagine, that will cause a lot of problems. Now, what are some of those symptoms? There's a lot of swelling, there's pain, you just can't walk right, you're feeling achy, stiffness, and there's limited range of movement. I know that woke me up when I couldn't walk properly and I was limping. That's not a good feeling. So definitely those are the symptoms to look out for. I did refer to some of the things that you will see like swelling and the joint is just tender. For rheumatoid, it could be the smaller joints. For osteo, it could be the larger joints, so shoulder, elbows. So those are some of the things that you find. Now, how do you diagnose arthritis? Now, the way to diagnose arthritis, you definitely have to talk to your doctor. If you're having problems with your joint and it's been going on for a while, it's not getting better, you need to talk to your doctor so they can examine you, ask you appropriate questions, get a good history, do a thorough examination, find out if your joints are swollen, if they're tender. They might consider, depending on the time frame, to do an x-ray, which could point to osteoarthritis, or they might do some blood work that could point to rheumatoid. Again, like I said, there's several types of arthritis. We're just focusing on the two main arthritis today. So definitely those are some ways to diagnose. Now, tips for preventing arthritis. We've talked about what it looks like, what are the risk factors, right? Let's talk about how we can prevent it. Now, prevention is better than cure. I am a strong advocate for that. So we need to know, right? So if there's a family history, you need to be aware of that. We already talked about what those risk factors are, right? So if you know what your risk factors are, you need to guard against it. You need to have a healthy weight so that you're not putting added pressure on your joints, because those joints cannot handle extra weight. You definitely need to make sure that you're wearing proper shoe wear, proper clothing, especially if you have flat feet. Like say if you have flat feet and the concrete is hitting against your knee or or your joints, you can have a lot of injury that way. So you want to make sure that you're having proper shoe wear. All of that minimizes the wear and tear of your joints. Now, smoking is not good, so you definitely want to get some help to quit smoking. I know we're creatures of habit, so I'm not saying it's going to be easy, but not doing it makes it worse. Now, you want to avoid injuries. Like when you play sports, like I like to be adventurous, but I always make sure that I don't overdo it. I always make sure that I move, right? Because when I'm not moving, I promise you, if I don't exercise within the week, my joints are stiff. I don't have those lubricating juices that are lubricating my joints for good range of movement. You want to make sure you're doing those things. Now, what are other things you're doing? If you have one of those jobs, repetitive jobs, you want to make sure that you might, if you have to have your elbow on the table, maybe have a soft pad that will protect your elbow. That also speaks to the precautions with the shoe wear. So there's several things that you can do. Diet is also important. Introduce a lot of, you know, anti-inflammatory foods. I know, anti-inflammatory foods. For me, what I do that has helped me, turmeric. I love turmeric. Turmeric is a wonderful seasoning. Its natural ingredients is called cumin, and it's like a natural analgesics rather. So it gets rid of inflammation in my joint. When you take it with black pepper, it actually increases the potency. So things like that. I know there's talk about apple cider vinegar that helps against arthritis. But have this conversation with your doctors, with your own doctor. Remember, I'm giving you general information. I'm not your own doctor. I don't know your unique situation, but these are some of the guidelines that have helped. Foods that are helpful, nourishing to the body, lots of fiber, lots of fortified vitamin D foods, iron foods, all those things that would give you strong bone, calcium, all of that, definitely important. Now, how do you treat it if you already have it? Yeah, since our guest did say that you cannot prevent it from, I mean, if you have it, you can't cure it, but you can manage it, right? So there's several ways. We already talked about the way to prevent it. If you do have it, how do you prevent it from getting worse? I found out that, my joints, I had some wear and tear. So I really needed to be careful when I go exercising. Proper shoe wear, the pain reliever does help, some NSAIDs. And when I refer to NSAIDs, I'm talking about ibuprofen, naproxen, but don't take that in the absence of your doctor, right? Have that conversation with them so that they can encourage you about the best way to use it. There's some topical analgesics that you find over the counter that helps to relieve the pain. Knee pads can help to prevent it from buckling, slip, and those things that tend to happen if the joint is unstable. Those are some form of management. Now, if it is so severe, that is where you hear that patients need knee surgery. Sometimes before that, they would get knee injections. But these are conversations that you need to definitely have with your doctor. So it's so important that according to the Arthritis Foundation, many doctors have taken to aggressive management, but that's why you need to know how to prevent it before it gets to that place where it's a debilitating disease. Early detection is definitely very key. Now, we've heard all this information. What is your key call to action? What are you going to do? How are you going to prevent arthritis? How are you going to prevent those wear and tear? So my takeaway message today is the Arthritis Foundation has estimated that in 2040 rather, 78 million people will have arthritis. Such staggering figures, we definitely need to guard ourselves against the danger of arthritis. And by being empowered with this information, we can stay consistent with being healthy. So I want to challenge you today, please share this with other friends. If you know people that are suffering from arthritis, share the information so that they can protect themselves or they can manage at least their arthritis, right? And when you're sharing, please leave a comment of what your call of action will be. What are you going to do? Are you going to cut back on all those sugary things that you're taking? Are you going to make sure that you eat fortified vitamin D, calcium foods that will keep you strong and healthy? We are in this journey together. We need to triumph at being champions, at living at our finest health. So I hope that this was helpful. If it was, please again, don't forget to subscribe. Don't forget to share your comments and share with friends and family. Thank you for staying tuned. Until next time, take care.